all women must be aware of how their breast feels like and looks like. Why this is important is because any changes in their breast, the person can notice these changes better if they know and if they feel how their breast feels like or looks like. Knowing about their own breast is very important because any changes can be appreciated better. Now coming to the warning signs, some patients can present with a lump, that is a swelling in the breast or in the axilla. Axilla is the armpit. Lump is usually the most common presentation of breast cancer. There are few characteristics of a cancerous lump that people should be aware of, and this lump is generally firm to hard in consistency. It usually does not move well within the breast, and one very important characteristic feature is, to start off with, most of these lumps are painless lumps. So this is one paradox where people tend to attribute a painless lump to a not so very dangerous condition, assuming that over a period of time the lumps will disappear on their own. And this is one of the main reasons why people also neglect presenting to the doctor with a lump. So a painless, progressive, that is the lump increasing in size gradually, and a lump which feels firm to hard in consistency is a lump that needs to be brought to the doctor's notice as early as possible. The other changes that we can notice are changes on the skin over the breast. So when there is a tumor growing within the breast, the skin overlying the breast tends to get pulled within the breast. Something that we call as indentation, or in medical terms, these skin changes are called as puckering or dimpling of the skin overlying the breast lump. So this again is another very important feature of a breast cancer. Other important changes that we can notice in patients with breast cancer are changes related to the nipple and the areola complex. So generally, patients who have breast cancer can have discharge from the nipple. Unusual, unexpected discharge from the nipple can be seen in patients with underlying breast cancer, and the discharges can be of various types, but those of cancerous concern are discharges which are bloody in nature or bloody in consistency, and they can also be watery in nature or consistency. Another important change that can be seen is the indrawing of the nipple. When there is an underlying breast tumor, just like how the skin over the breast gets pulled within, leading to dimpling, the same can happen with the nipple areola complex, which can get pulled by the breast tumor, and the nipple tends to get pulled inside. The other changes that we can notice in breast cancer are generally changes of asymmetry in the breast. Whereas one breast looks like how it was normally, the affected breast either tends to be pulled up or it tends to increase in size due to the volume of the tumor present in that breast. Hence, any abnormal changes in the breast or asymmetry in the breast which is of a recent occurrence needs to be evaluated and needs to be brought to the notice of the doctor.